Welcome to St. Luke's Health Now, a show dedicated to giving you the most up-to-date information on innovative medicine. I'm your host, Ashley Rousseau, and we have a unique show for you this evening. We're talking about the medical education programs offered at St. Luke's University Health Network. Tonight, we'll be joined by a talented panel of experts from the field. Stay tuned. This is St. Luke's Health Now. Coming up on this episode of Health Now, an in-depth look at educational programs offered at St. Luke's University Health Network. Stay tuned. Thanks for being here. Let's get started. We have an accomplished panel of guests joining us tonight. Up first, we have James P. Orlando. JP is the Chief Graduate Medical Education Officer at St. Luke's University Health Network. Earning his Doctor of Education degree in Corporate Learning Leadership from the University of Pennsylvania, Dr. Orlando also serves as an adjunct professor at Moravian University, as well as the University of Pennsylvania, and on several national boards, including the Institutional Review Committee at the Accreditation Council for Graduate Medical Education. Thanks so much for being here, JP.
Hey, thanks for having me.
So St. Luke's was recently named the #1 teaching hospital in America by Watson Health, which is pretty incredible. What does this mean, and why is it important to the network and to our community?
It stands for high performance in clinical outcomes and in work environment, in learning environment, in all the performance improvements that we do. There's a lot of research out there that points to the whole fact that like where you train matters, and so if you want to be a top 100 doc in the future when you graduate, you want to come to a top 100 hospital. And so that's what St. Luke's represents. And so when you look at that whole thing around, top, #1 teaching hospital in the country, that's what they get when they come here.
And that's really exciting and good news. And it's nice to have that data backing that up. So thanks for being with us,
Yeah,
JP. Joining our panel next is Dr. Shadden Eldekar-Hein. Dr. Eldekar-Hein is the Senior Associate Dean of the Temple St. Luke's School of Medicine. She's a Temple School of Medicine alum and an internal medicine physician who's passionate about hospital-based medicine. She also holds a master's degree in bioethics and has received numerous awards for her teaching, research, and faculty service. Thanks for being here, Dr. Eldekar-Hein. So great to have you.
Thank you so much for having me.
So Temple St. Luke's School of Medicine is the region's first and only school of medicine. It allows students to become doctors right here in the Lehigh Valley. So innovative on the part of St. Luke's. How did this partnership with Temple begin, and why is it important for the Lehigh Valley community?
The partnership actually began when I was in medical school, and there was a clinical campus. So we were hosting the 3rd and 4th year of Temple students at that time, and this was in the early 2000s, and progressed to, as the GME programs increased, our president, Rick Anderson, had a good relationship with our dean at the time, and they discussed at that time expanding the medical education to include a regional campus. And so about 11 years ago, the regional campus started as a 3-year campus, finally to 2 years ago as a 4-year campus. And the idea was to train our own, to bring people to our community, train them to be amazing physicians, and hopefully come back to our community to practice.
It's so special and unique to go to the Temple St. Luke's School of Medicine and have that big school medicine, but at a community feel. So very innovative. Thanks for being here.
Thank you so much.
Let's meet our final panelist, Dr. Lisa Stork. Dr. Stork is the director of St. Luke's School of Nursing. She's had more than 40 years' experience in nursing at St. Luke's, both as a staff nurse and as an educator. She received her doctorate in nursing practice from DeSales University and her master's of science in nursing from Seton Hall University. She's been a nursing instructor at multiple institutions, including Moravian University, Lehigh County Carbon Community College, and St. Luke's School of Nursing. Welcome, Dr. Stork.
Thank you for having me.
Tell us why you got interested in the field of nursing and why you've stayed at St. Luke's for 4 decades.
Well, I've always had a passion for helping others, and I joined St. Luke's, and I came there and I really felt like I had a passion there. I was appreciated. I was afforded many opportunities throughout different departments to grow and expand my education. And I love sharing that with others and the students as well.
Thank you all for giving us some great background information on your expertise and the medical education offered at St. Luke's. Next, we'll dig deeper into specific programs and training offered by the network. Stay tuned. We'll be back after a short break. You're watching St. Luke's Health Now.
School of Nursing prepares their graduates for any role. Really, there are no limits to where your education can take you.
If you're going to be a nurse, you want to be the best nurse possible. If you want to be the best nurse possible, you should go to the best nursing school possible. And St. Luke's, as being a part of the #1 teaching hospital in the country, is the best nursing school that you can consider.
My name is Nicholas Roma. I'm a PGY1 internal medicine resident on the cardiology track here. Being here at St. Luke's puts me in a great place. I'm from the Lehigh Valley, so I've always known I wanted to stay in the Lehigh Valley. The Temple St. Luke's program is set up. It's a 40-person class, and right now it's all 4 years are done in the Lehigh Valley. The biggest advantage of the program is that all 40 students are right here, and so there's a really great one-on-one interaction with attendings, with administration, and with advisors. So I want to do interventional cardiology, which is, stents, balloons, and it's a procedural cardiology field in the cath lab. What really spoke to me about that is I've always known I wanted to do some kind of surgery, and instead of doing a general surgery residency, this allowed me to, do a procedural field in cardiology. The transition's been really great. St. Luke's really sets you up to, excel in residency, and being, familiar with the floors, with the EMR here, it really should be hopefully a smooth transition. I hope to obviously, put the patient, before myself and, give everything I can to the patient. St. Luke's is an excellent place to train doctors because I personally have seen firsthand how the doctors really go above and beyond for every patient. They really strive to give the patient the best care, no matter what the circumstances are, and that's the type of physician I envision to be. Starting residency is a little overwhelming, and I know though that being here puts me in a really good place and I'm really well supported, so I'm nervous, but at the same time I'm excited. It feels really great to join the St. Luke's team. I really hope to treat the community that I grew up in that has given so much to me.
Welcome back. Thanks for being with us tonight. I'm Ashley Russo, and this is Health Now. We want to thank our viewers, all of you, for watching our program tonight and for providing us with questions for our panel, which we'll get to later in the show. Joining me is a talented group of medical professionals: James P. Orlando, Dr. Shadden Eldikar-Hein, and Dr. Lisa Stork. We've learned about your expertise. Now we're going to dive deeper into the medical education programs that are offered at St. Luke's. All right, so JP, I'm going to start with you. What role does St. Luke's play in educating physicians and preparing them to practice medicine?
So today we train 420 residents and fellows in 45 graduate medical education programs, compared to even just 5 years ago where we were training 180 residents and fellows in 20 graduate medical education programs. And so the role that St. Luke's plays in that is making sure that there are all these different specialties that are out in the community and are available as the community evolves and needs more sophisticated care of the baby boomers and so on and so forth with that. I think St. Luke's has always been on the cutting edge when it comes to education in general, whether it's the nursing school or the medical school or graduate medical education. One of the things that I like to tell the new folks the new residents who come on board, I'm going to be talking to them tomorrow. 150 some new residents and fellows that we're onboarding. And so, back in 1872, St. Luke's had visiting attendings that really staffed the medical staff. I mean, there was only one attending. They all were visiting attendings that came in from New York and Philadelphia and that. And they would bring residents with them. And so, if you think about it, we're celebrating our 150th, anniversary, and I like to say, and I'll say this tomorrow, hey, you're the 150th class of residents and fellows, to come through this institution. So, it's a long history that we have. We've had very visionary leaders, William Estes Jr., who was the president of the American College of Surgeons back in the 50s, very visionary about, surgeons need to get more involved in the producing and supporting the high quality of the health system. And that exists today, and that continues today. Again, going back to that whole #1 teaching hospital thing that we talked about earlier. So
It is incredible. The 150th class, they're coming on board now, and I love that. But it's not just the medical school, it's all of this graduate medical education. But before all of that, they do have to go to medical school.
Yes, they do.
What is unique as a Temple Medical School grad and now working at St. Luke's? What's unique about the medical school at St. Luke's that's in partnership with Temple?
Having had my education in Philadelphia predominantly as a grad, and now seeing the focus here in Bethlehem, I would say what's unique about it is just the community-based care that we're providing. It's really nice for the students. They're in a smaller campus and they're treating the community they live in, which I've always really appreciated. But in addition to that, I would say the small campus allows for the students to have really great relationships with their teachers and their attendings, and really wonderful mentorship. So they're working on research projects and service projects, and again, learning medicine from our community, which I think is really important, but also serving the community at the same time. And I think that's what makes our campus unique, is probably the size and the community-based care that we're able to provide.
And you mentioned that the ability to work in a smaller environment, but with really big city medicine and all the great technologies, such a cool opportunity. And Dr. Stork, I want to turn to you because this also applies to our nursing students. There are so many nursing students, and why would somebody want to go into nursing, and what types of degrees are available? What's needed at St. Luke's?
Well, St. Luke's certainly is supporting the School of Nursing, and we are very fortunate. We have 13 campuses, so our students get these opportunities that many nursing programs do not afford. Certainly during the pandemic, we were able to continue to be in the clinical setting where many schools were just doing their clinical, I don't mean just, but doing their clinical via simulation and virtual. So there's many different ways to go to the nursing profession. We have a diploma in nursing. It's a 20-month program. They do need the prereqs before they come. No matter whether you're getting your diploma, associate, or bachelor's degree, it's still the same NCLEX exam to become a registered nurse. It's just a little bit shorter time, and we certainly do encourage our students then to go on and get their bachelor's degree, and they're afforded the opportunity to have that tuition paid by St. Luke's.
Which is amazing, and so many opportunities. So we've talked about nursing and about going as a physician, but JP, there are other things happening in medical education at St. Luke's, like the School of Phlebotomy as an example. So tell us a little bit more about some of the other opportunities that exist at St. Luke's.
The School of Phlebotomy is, so it's a brand new program. We've had an overwhelming response to it. We had our first class, 150 applicants for 30 spots. And the program continues to grow, and so that's on a rotating basis throughout the year. So we have a radiology tech school, a surgical tech school, medical assistance school that we work with, and so all of that is, and that's great opportunity for the students that get into those programs, because again, they train in a high quality environment, right? And they're going to practice like that.
And I would imagine if someone comes in to be a radiology tech and then they figure out that maybe they want to go into nursing or they want to advance onto medical school, those opportunities I would imagine are out there for them. Lisa, have you seen that happen?
Absolutely. I just had a call from an employee in the network, and she's been working in SLPG in the physicians group, and she said she's been waiting, she wants to be a nurse. We've had somebody who was in another department, occupational therapy, physical therapy, who are just looking for another opportunity, and they're afforded many opportunities.
Great information from all of our panelists, but we're not done yet. After the break, we'll learn more about tuition, growth, and the commitment of St. Luke's University Health Network to better educate their students. You're watching St. Luke's Health Now. Stay tuned.
Interested in a medical career? Consider St. Luke's if you want to be a doctor or a nurse. Based in Bethlehem, Pennsylvania, we are the area's only 4-year medical school and the largest provider of medical residencies and fellowships, and the country's longest-running school of nursing, trained at an organization that is nationally recognized in education, patient care, and quality. See why we are ranked the nation's #1 teaching hospital. Where you train matters. The best doctors and nurses train at the best hospitals. St. Luke's University Health Network.
My name is Liz Taylor, and I am the Network Director for St. Luke's Outpatient Lab Services. The St. Luke's School of Phlebotomy is a program that teaches an education in phlebotomy through a combined delivery of both didactic, which is theory lesson in a classroom setting, along with hands-on clinical experience at one of our outpatient service centers. The program is 12 weeks. The 12th week includes 40 hours of really hands-on clinical practice in a clinical setting at one of our patient service centers. The program is for anyone who has successfully completed high school. Our School of Phlebotomy really touches on not only phlebotomy skills, but also touches on medical terminology and customer service skills, which really provides a foundation for many different positions. We offer 3 different sessions, both daytime and evening hours, that really supports people that either are currently working or those individuals that have a very busy family life. When someone completes our program, they come out with not only the interpersonal and clinical and technical skills, but also the confidence and the good judgment to enable us to provide that goal of that outstanding experience.
Welcome back to St. Luke's Health Now, a show dedicated to giving you the most up-to-date information on innovative medicine. I'm your host, Ashley Russo, and we have an interesting show for you tonight. We're talking about medical education programs offered at St. Luke's University Health Network. In case you're just tuning in, I'm joined by 3 St. Luke's medical professionals, James P. Orlando, Dr. Shadden Eldekar-Hein, and Dr. Lisa Stork. Thank you guys for being here. The first part of the program, we learned a little bit about what you do and why you do it. We learned a little bit about the programs that are available. But I want to dive deeper into education and the support offered, because a lot of times the concern if going into a medical field is the cost and those student loans. I mean, Dr. Eldekar-Hein, you are a physician. You went to medical school. The loans can be super daunting. How is St. Luke's making it easier for someone to make the choice to go into the medical field?
I always talk to our applicants about St. Luke's and our community's commitment to bringing the best and brightest to our medical school. And it started before the medical school started. As there was discussion about bringing the medical school and the partnership to the Bethlehem area, an endowment was started. And there was a really big push from St. Luke's and the community to increase that endowment. And the endowment is only used to apply tuition assistance to our students. And so when I talk to the applicants in general about how important their education and them being in our community is, I always mention our endowment, because really it's to benefit our students, and their education is very important to us.
Which is really incredible, and it extends beyond just training to be a physician. Lisa, tell us about the nursing school, because there's not only support available for people who want to go into nursing, but there are different types of programs and schedules offered, I believe, for people who might be working part-time or going back to school. Tell us a little bit more about those options.
We have 2 programs. They are both full-time. There's a day track and an evening weekend track. So the evening weekend track, they have clinicals on the weekend and class in the evening from 6 p.m. to 9 p.m. So that kind of works well with those folks who have families and other job commitments during the day and during the week. And then the day program is the traditional program where we have class Monday through Friday during the day. But they're both full-time, though we have a great variety and diversity in our student population. We have 19-year-olds who worked ahead in dual enrollment in high school and got their prereqs done, and then we actually have some folks who are in their 50s and 60s who are returning to school. And we currently have a tuition program going right now where tuition assistance, if you are a budgeted position, that means you're a St. Luke's employee working 16 hours a week in any capacity, does not need to be at the bedside, could be in the cafeteria, could be in the cashier, could be anywhere. And their tuition, they're benefit eligible through Human Resources, they can have their tuition paid up front as well as most of their fees. So they can graduate pretty much without owing any money for those employees, which has been amazing.
That is an incredible motivator and really such a great opportunity that St. Luke's has put out there. 16 hours a week, get your nursing degree and get it paid for. Pretty incredible. JP, how is St. Luke's solving the shortages that we're seeing in medicine through all of these programs, and how do they figure out where the need is?
When you look at the shortages that are out there by all these different associations, according to the Association of American Medical Colleges, by 2030 we will be short 120,000 physicians in the United States. Well, when you dig into that number a little bit, about 40% is primary care. And so when we started our whole initiative to respond to our community health needs assessment, to respond to that shortage, we were pretty strategic about how we did it. So we opened up a handful of more family medicine residency programs, started a pediatric residency program, started another internal medicine program to make sure we have enough of those residents and physicians out in the community. There was a report that came out from Pennsylvania Commonwealth, they did a report in December that basically said that that we're going to be short by 2034 of about 1,000 physicians, primary care physicians in Pennsylvania. And so that was another reason to actually, focus in starting on this stuff. So one of the things that we do is, we do incentivize, we have different tuition assistant programs for helping that. So we have tuition assistant programs for basically paying for all their medical school. That's how we're using graduate medical education in general to really be strategic and to make sure that we're responding to community needs, and most of all, aiming for where the puck is going, not where it is right now.
Dr. Eldekar-Hein, I want to ask you, as a physician who is in primary care and works in the hospitals and works with the students, how does it make you feel to see these young people coming up and making the choice to go into medicine? Because it is a challenging choice. It's a long road, costs a lot, and St. Luke's is doing everything in its power to make it easier and more available and accessible. How does that make you feel?
I've always felt that medicine is inspiring. I mean, I feel like it's somewhat of a calling, and I'm continually inspired by the students coming in. They're doing, I always joke, they're doing more than what I did 20 years ago. They're already on the cutting edge of research and service, and they're really amazing students. And so I would say that the students are inspiring, and we need that innovation to push medicine forward. And it's a blessing to be a part of their medical training in their lives, especially knowing that we're serving a community that I care for a lot.
Thank you all for such an engaging conversation. Up next, questions from our viewers. Stick with us. You're watching St. Luke's Health Now.
St. Luke's has been a cornerstone of the Lehigh Valley for over 150 years. It was originally founded to provide industrial workers with immediate local access to care. In the last century and a half, while healthcare has transformed dramatically, St. Luke's dedicated physicians, employees, and volunteers have proven they can respond to changes with exciting, innovative, and bold healthcare solutions. St. Luke's ability to deliver the highest quality care at the lowest cost is truly transformational and will ensure our future.
Welcome back to St. Luke's Health Now. I'm your host, Ashley Rousseau. A special thank you to our outstanding panelists. We've had a great conversation about medical education offered at St. Luke's. All right, now we're going to read some questions from our viewers. All right, the first question, Dr. Eldekar-Hein, I'm going to ask to you. I'm considering going to medical school, but it's very expensive and very time-consuming. Where do I start?
As I had mentioned earlier, St. Luke's is committed through our endowment in terms of tuition assistance. If someone is interested in, from the start, primary care, one of the programs that students can get this nearly free tuition would be through coming to our medical school, graduating into our graduate medical education programs run by JP, and then choosing to stay in our community at one of our campuses to provide that care in our community. And with that, there is a tuition reimbursement program where tuition is nearly free.
Which is so incredible. I mean, what an amazing opportunity. Really removes that barrier and that concern for anybody who's thinking about going into medicine. All right, Lisa, this question I'm sure is for you. One viewer writes, I'm considering going back to school to become a nurse, but I think I may be too old. Any advice for me?
Absolutely, you're never too old. Never too old. And as I mentioned before, we have a diverse population. There's support for no matter what age you're interested in. We do actually have right now a handful of students. We have a couple mother-daughters in the program, and we have a few who waited until their children were all grown up and now have time to pursue their dreams.
Dr. Stork, you mentioned earlier the full-time programs, but what if someone wants to go part-time? Is that an option? Can they go to nursing school part-time?
Not at St. Luke's. We're only two full-time programs. I mean, the evening weekend track, people seem to think it's part-time because they can keep their jobs, but it is a commitment that they need to be able to prioritize to get their studies completed in a timely manner and do well.
But nice to know that you can do that evening weekend combination if you have other responsibilities during the week.
Absolutely, absolutely.
Excellent. All right, JP, this is for you. What is next for graduate medical education at St. Luke's? What are we going to see in 3, 5, 10 years?
I would say even more of a focus on rural health and getting rural training programs up and going and sustained. So about 15% of our population is in rural areas in the country. Those populations have higher healthcare costs, they have lower access to the different specialties in that. And so if you look at the research on it shows that if you could start and get physician residents in these communities early, then about 50% of them stay, right? And so to have better access for the rural population and to provide them with the services that they need, starting these programs is really key. So back in 2018, we started a family medicine rural training track up at one of our Carbon campuses. And so we have 4 hospitals in that rural area. And then we just started a psychiatry residency program up there as well. So when I look 5-10 years out, it's really developing that area so that our community, with the footprint that we live in, that we serve, has adequate services there immediately. They don't have to travel.
Really amazing how St. Luke's is answering the needs of the community. All right, this is a great question, and I think that this is for you, Dr. Eldekar-Hein. I've considered medical school, but I've heard some challenging stories from my uncle, who's trained to be a physician 30 years ago. How does med school look today compared to what it was back then?
Everyone goes into medicine to take care of patients, but oftentimes, at least in earlier training, medical school was really focused on lecture-based in the first 2 years, but now we're moving our clinical training earlier. And so the students are exposed to physicians and clinical cases and patients much earlier in their training. And I think this engages them in a different way to understand and apply the books and the science to their patients. I think medical school still is challenging throughout, whether it was 30 years ago, 20 years ago, or now, but we are engaging the students in what they came to do and what they were called for, which is that clinical care in the community.
All right, well, we have had a great program, but before I let you go, I'd like to ask each one of you to answer the question, what excites you about the future of medicine? Dr. Stork, we'll start with you.
I will say what excites me for the future of medicine, including nursing, is the many, many, many opportunities. And you make a difference in the lives of everybody, everyone you touch. From your first day you're in the hospital, our school starts their 900 hours of clinical the first week of the 20-month program, to the lives I'm touching as the director of the nursing program, and seeing those people progress from day one when they can't even really figure out how to get onto the website to figure out what courses they need to take, to when they walk across that stage and graduate.
Absolutely wonderful, wonderful. Dr. Eldekar-Hein, what about you?
I think the future of medicine, it's incredibly exciting and inspiring, and I would say that the connections we're making with our patients is always on the forefront. It has always been important, and making those connections with our students from the day they start medical school, I think is really important. But also, medicine is changing and innovative, so being a part of the changing therapies and the newer therapies that we're offering our patients while making those connections and promoting their health, I think, is also incredible.
It's very exciting what's going on. Dr. Orlando, what about you?
Well, just to add to that, I mean, you always have the technology and the innovations that are coming from technology, new ways to do things. On the flip side, the joy in medicine that I see more and more in our attendings when they are interacting with patients, when they're interacting with students, residents, that it really tapping into why they came into medicine in the first place, right? And if we can always get back to that place, boy, I'll tell you what, there's a bright future, not just for us, but for our community.
Thank you so much to all of you for being here, and thank you to all of you for tuning in. For more information on medical education offered at St. Luke's University Health Network, please visit their website at sluhn.org or call 1-866-ST. Luke's. I'm Ashley Russo. This is St. Luke's Health Now. Thanks for tuning in. Until next time, be well, and remember, it's important to focus on your health now.